Hi, I'm going to be your nurse today. I'm going to perform some hand hygiene. I'm going to check your name and date of birth. Can you tell me it, please?
Hannah Overland, 5'6", 96.
Perfect. Okay, and can you tell me why you're here today?
My right wrist hurts.
Your right wrist hurts. And when did that begin?
About 2 days ago.
2 days ago? And when did it begin hurting?
About right here.
Right there? Can you show me on the inside or the outside?
It hurts about right here.
Right there?
And I can't move it.
Okay. Have you had any other symptoms with it? No. And can you describe the pain for me?
Yeah, it's sharp all the time. Like I said, I can't move it.
Yeah, okay. And on a scale of 1 to 10, 10 being the worst, what was your pain? A 7? Okay, all the time? Okay. And have you tried anything to relieve the pain?
Yeah, I've tried icing it for 15 minutes off and on. And then I've taken ibuprofen 3 times a day with 2 tablets.
And has that done anything for you?
Not really.
No. And is this your first seeking of treatment? Yes. Okay, well, I'm sorry that you experienced this pain. I hope we can help relieve it. I'm going to do a full head-to-toe assessment. I'm going to do vitals right now. So do my vitals. Okay. So I'm going to begin with your head. If you can take your glasses off for me. I'm just going to touch and feel. I'm inspecting for any lumps or bumps. Do you have any tenderness when I place my hands here? No? What about when I'm pressing on your face? Any pain here? Okay, I'm looking at your facial features, making sure they're symmetrical. Okay, I'm going to begin with your eyes. Test cranial nerves 2 and 3, looking for your pupillary response. So I'm going to shine the light in one eye. Yeah, there you go. And both eyes. Okay, that's testing your cranial nerves 2 and 3, making sure your pupillary response is equal and active, which it was. I'm going to have you look at my finger, and then I'm going to have you look ahead. Okay, again. Okay, your cranial nerves 2 and 3 are intact. So now I'm going to move to cranial nerves 4 and 6, which is your extraocular eye movement. So I'm going to have you follow my finger without moving your head. Okay?
Hi. Hi, my name's Sarah. I'll be your nurse today. Can you tell me your name and date of birth?
Perfect. Cranial nerves 4 and 6 are intact. I'm going to move to cranial nerve 5. I'm going to place my hand here. Do you feel this?
Alright, can I check your
Can you
wristband?
draw open? Side to side.
Okay, I'm going to wash my hands and then
I'm
we'll
going
get
to test
started.
cranial nerve 7. Can you smile for me?
Wash his hands.
Brown.
Okay, Elena, what brings you in today?
So I've been
Eyebrows?
having
Okay.
headaches
Cranial nerve
for
7
the
is
past
intact.
6 months.
Have you had any changes in your nose?
And when did
Smelling?
that start?
I'm going to palpate. Do you have any tenderness here?
And where are the
Feeling for any tenderness, any swelling?
the back of my head.
Okay, and
So have you had any changes in your ears? Any drainage?
Specifically,
No changes in hearing?
and it lasts for about
Also, have you had any changes in your vision? Okay. So I'm going to have you occlude this ear, and I'm going to whisper something in your ear, and you're going to tell me, okay?
okay. And does anything accompany that pain?
I have some blurred vision.
Okay, cranial nerve 8 is intact. Okay, so now I'm going to move to your mouth. I'm going to have you open your mouth for me. I'm looking at your pharynx, your teeth, your mucous membranes, which look pink and moist.
Everything, no.
Okay, stick your tongue out. Say ah. Can you press your tongue against your cheeks? Okay, cranial nerve 9, 10, and 12 are intact. So now I'm going to move to your neck. I'm going to press and palpate if you notice you have any tenderness.
Okay, and then
Have you noticed any skin changes?
so when you say it
Okay.
started
I'm
from
feeling the trachea, making sure that it's midline.
When did this
Do you have any pain when I do this? Okay. I'm going to move
so I
here.
say I've been having it for the past 6 months, and
I'm going to have you swallow for me. Okay, making sure that it doesn't deviate when you swallow. And you had no pain when you did that? Okay, I'm going to test cranial nerve 11 real quick. If you can shrug your shoulders.
Wait,
Okay, and do you have
is
any
that
pain with
after you
that?
ask onset?
Okay, so now I'm going to move to your respiratory system. If you can take your shirt off for me. Okay, so I'm inspecting first, making sure we don't have any skin changes. Have you noticed anything different? Okay, I don't see any obvious lesions or anything like that. So I'm going to listen to your breath sounds. If you could take a deep breath in and out when I place the stethoscope.
December 27th, 95.
Alright, Elena, can I check your wristband? Great. I'm just gonna wash my hands and then we'll get started. Provides privacy, wash his hands. Okay, Elena, what brings you in today?
So I've been having headaches
Okay, when did those headaches start?
about 6 months ago, but this particular one was 6 days ago.
Okay. And where are the headaches located?
On the back of my head.
Okay, and how long do the headaches last for?
About 3 hours in the morning.
Okay, and do you
All of
describe
your
the
breath
symptoms?
sounds sound
So
clear.
it's
Patient.
really sharp and
I'm
then
also
it
going to
goes
palpate
to
real quick and let you know if you have any pain.
And
You won't feel any lumps or bumps. I'm not sure for any
No.
abnormalities.
okay,
Okay,
does
I'm going to
anything relieve it?
test your test your chest
Have you
expansion.
taken
If you
any
take a deep breath.
No.
Okay,
Just making sure that you have symmetrical chest expansion. So now I'm going to move to the front.
see what we
I'm going to do the same thing.
okay? But
Okay,
I'm
do you
just
have
gonna
any
do some
tenderness?
quick vital signs on you, and then we'll start on a head to toe.
Have you noticed any skin
Okay.
changes?
Okay, so I took her
So I'm going to
vitals.
listen to your breath sounds once again.
Okay, Lena, I'm just gonna start
If you
with
could
your
take a
head.
deep breath in
Everything
and out.
appears to be symmetrical. Your skin's intact. No obvious lesions or trauma. I'm just gonna palpate your skull. Okay. I don't feel any lumps or bumps or anything. The hair is evenly distributed and no missing patches or anything.
your
I'm
breath
gonna
sounds
palpate your
location as
sinuses.
well.
Tell me
Have
if
you had
there's
any
pain
shortness
or
of breath,
tenderness.
wheezing, any coughing?
Anything?
No.
Nothing?
Okay, good.
Okay.
Can you
So I'm
feel
going to move
this?
to your cardiac sound now.
Okay. Can you
So I'm
clench
going
your
to
jaw
listen
for
to each
me?
cardiac sound. I'm going to start at your aortic.
Great. Okay, so cranial nerve 7 is intact. Can you
Now moving to pulmonary.
smile for me? Can you frown for me? Can you puff out your cheeks for me?
I'm going to move to
Can
Earth's
you squint
point.
your eyes for me? Great. Cranial nerve 5 is intact. Okay.
Lift your breast tissue
Now
for me,
I'm going
please.
to
Now
move
listen to your
on
triceps.
to your ears. Okay. So actually, I'm gonna go to
And
your
then your
eyes first. Just look at my face and I'm gonna shine this light.
That's something I forgot. I'm going to listen and feel for your.
Great. Okay. Now I'm gonna do the other eye.
Okay. Have you had any
Good. Okay. So.
Have you had
Can
any
you look at my
palpitations,
pen light and then focus
chest
on
pain,
something in the
dizziness?
distance? Good.
Any swelling
Okay,
you've
cranial
noticed?
nerves 2 and 3 are intact.
I'm
Now
going to check.
have you follow my pen light with
Can you
only
see
your
your
eyes,
hands?
okay?
So I'm going to look. I'm looking for edema. I'm going to feel for your radial pulse on both sides.
Great. So cranial nerves 4 and 6
I'm also
are
going to
intact.
check your
Okay, now I'm
capillary
going to
refill.
move
And
on
both
to
of these
your
are just making
ears.
sure that you have circulation
Your
around your hands.
ears, the skin is intact, no obvious lesions or trauma. Is there any pain or palpation?
Okay, so now we're going to
Okay,
move to
good.
your
I
abdomen.
feel like a good temperature. I don't notice any drainage or anything
So before you
like
touch,
that.
I'm just going to.
I'm gonna check your hearing now. So can you hear this?
Have you had any changes in
Okay,
skin?
good. Now I'm gonna have you plug one ear and I'm gonna whisper something and you repeat
So I'm
it
gonna
back to me,
listen.
okay?
2 to 4 vowel sounds.
Cat. Good. Now the other ear, please.
I'm going to start in your right upper quadrant.
Dog. Great. Okay, Alina, now I'm going to move on to your nose. Your nose is in the proper position. Everything
Moving down to your
seems
left lower
symmetrical.
quadrant.
I don't notice any drainage or dryness around your nose. Do you have difficulty smelling at all?
No.
Okay, what about any drainage recently?
No.
Okay.
So you had vowel sounds in all 4 quadrants.
Can you smell this?
So now I'm going to press. Are you
Okay, what is
ticklish at
it?
all? No.
Lemon. Great. Okay, Lena, now I'm gonna move on
Let me
to
know
your
if you have
mouth.
any tenderness.
Okay,
I'm
so
feeling for
the
the
outside of your mouth
organs,
looks
making
good.
sure
I
that
don't
you don't
notice
have
any
any abnormal lumps or
chapped
bumps.
lips or anything like
Okay, I'm going to
that.
press a little harder.
Can
Let me
you
know if have
open your
tenderness.
mouth for me? Okay, dentition's intact. Mucous membranes are intact. It's moist
And
and
when
clean.
was your
Can you
last
stick out
bowel
your
movement?
tongue?
Yesterday.
Great. So
have you had any
uvula
concerns
is
with your bowel
midline, your
movements?
tongue is
No?
midline.
Have you been passing
Can you say ah for me?
And how have you
Good.
been
So
seeing, or
cranial
any
nerves 9 and
difficulties?
10 are intact.
No?
Can you shut your mouth and then push on your cheeks with your tongue? Great. So cranial nerve 11 is intact.
Okay, so now I'm going to move to your
Okay, now I'm
musculoskeletal
going
system.
to move
Okay, so I'm
on
gonna first
to
have you do range of motion of your head. So if you could go down,
your
back up.
respiratory.
side to
And
side.
so I'm just
Press
gonna
your strength
assess
if you
your
can
skin.
push against me.
Everything looks.
Perfect. Okay, so now we're going to do range
No,
of motion.
first I'm
shoulders
gonna do your neck
above your head.
actually. So your neck looks symmetrical. Your
Okay,
skin
your
looks
elbows
great. No lesions or
out
visual
and in.
trauma. I'm just gonna
Okay,
palpate.
stick your hands out and go
Great.
in and out with your wrists.
Your
up and
trachea
down,
doesn't have any
around.
lumps or bumps
Okay,
or
your
anything
fingers
like that. I'm gonna
in and
feel
out,
your carotid
side to side.
pulse.
Perfect. Do you have any pain with
Very
that?
nice and strong.
Okay,
Now I'm
so now we're
gonna
gonna move
move on
your
to
legs.
your respiratory system.
And I'm looking for
your
any
skin on
edema,
your chest looks
any swelling.
good.
Have you
I
noticed
don't
any
see
skin
any
changes?
obvious lesions
No?
or trauma
Okay,
except
I feel
for these
equal temperatures on both sides.
red spots, but
Okay,
that's
I'm gonna
nothing to worry
feel
about.
for your
So I'm gonna
dorsalis
palpate.
base pulse
Let
at
me
both
know
feet.
if there's any pain or tenderness.
And place that down.
Okay, I don't feel any lumps or bumps either. I'm gonna do the same thing on your back.
I'm gonna have you
The
press
skin
against
on your back looks
my
good.
hands.
Let me know
Okay,
if there's
and then
any
press against
pain
again.
or no
Okay, checking for
anything. Okay,
capillary
I don't
refill.
feel any lumps or bumps. Just
Making sure that we have circulation down. Can you roll around your ankles for me? Do you have any pain doing that? No? Okay. And I don't notice any edema.
so now I'm
Okay, I'm also going to
listen to
test
your
up here,
breath sounds,
looking
okay?
for also any skin
So,
lesions, anything different.
Just every time my stethoscope
Have you noticed any
touches your
skin
chest,
changes?
take a nice deep breath
No?
with me,
Okay.
okay?
I'm going to test your upper body strength, so if you could place your arms like this and resist me.
I'm gonna reach
Okay,
underneath.
again, resist me. Perfect. Okay, so if you can stand up for me,
Great. I'm gonna
and
do the same
stand
thing
over
on your
there
back,
and walk
okay?
towards me heel to toe. Okay. Perfect, and you can turn back around a little. Perfect, now I'm just looking at your gait.
I'm gonna reach
Okay.
underneath
So
your
now I'm going
bones,
to do range
okay?
of motion of your back. If you turn like this for me, and back and forward. Okay, perfect. Do you have any pain with that?
Okay,
No?
two more,
Okay, if
one
you
on
could
this
turn around and face the other
lateral
way
side.
and bend over for me.
Good. One
I'm
more
just
on
feeling
this
your
lateral
spinal
side.
alignment, making sure we're aligned, making sure your
Great.
shoulders are at the same length.
Okay.
Perfect. You can stand back up for me.
Alina,
Sit
have
back
you
down. Do you have
experienced
any pain with that?
shortness of breath?
Have you had any
Any
joint
coughing?
pain, any swelling?
Wheezing?
No?
No.
Any numbness or tingling?
Okay,
Okay. Well, I
any
think
blood
that
in your
concludes
sputum?
our
Any
It's
sputum at
no.
all?
Do you have any questions?
Okay, good. Well, your breath
Okay,
sounds
we can
sounded
get
clear
dressed
and
now.
the skin on your back and your chest
go.
looks great. We're gonna move
I'm
on
on
to
your
your
back.
cardiac. So
Thank
if you
you.
could lay down for me, that would be great.